Children who see violence need tools to help them get through it. That's the thought behind neighborhood trauma centers that are opening in Cincinnati. 2 are now opening. Angela Ingram is here now to explain to us how they work. Angela?
Well, Rob, this is a pilot program that the Ohio Attorney General's office is funding. The organizers started it after a shooting near a Cincinnati public school where kids actually saw the body. People in that neighborhood knew something needed to be done to help those kids cope.
If you're from a neighborhood that sees a lot of violence, you may be traumatized by what you see. That's the basic principle behind trauma centers that are going into 2 Cincinnati neighborhoods, one in Westwood, the other in Winton Hills.
So what happens in a child's brain when they experience trauma over and over again is it actually rewires the brain. And so without treatment, children are prone to become perpetrators.
Tonight, volunteers are getting trained by mental health professionals from Children's Hospital on how to help kids in particular.
These are the basic skills of connecting with children and with teenagers.
It's recognizing that a child or young people have had this trauma and knowing that through these experiences and through this work at the center, you're going to build up resilience and perseverance.
People who live and work in those neighborhoods know that the impact on children has a far greater reach. Vanessa Enoch wrote a $135,000 grant to fund the project, and agencies and volunteers citywide are partnering to help.
It's Cincinnati Public Schools, it is the Pivot program, the Neighborhood Enhancement program, the Health Department, it is the Police Department.
The goal is to intervene while children's hearts can still be healed.
It's nice to be important, but it's also important to be nice. So with that, how do you approach people in a way to where they know that you really care about them?
And Vanessa Enoch is in the process of writing another grant to help expand that project. They're starting with sexual abuse survivors and then branching out to other children who've experienced trauma. Rob, back to you.
Thank you very much. Teachers, police officers, and other partners will be able to refer children to the centers for treatment.